Okay, everybody, why don't we get started with the Homelessness Prevention System briefing. Thanks for taking the time out of your day to join us. As a reminder, please keep yourself on mute throughout the briefing. If you have questions, please write them in the chat and we will answer them during the Q&A period. And just as an FYI, this session is being recorded for folks who haven't been able to join us today. Thanks for being here. I'm Jen Loving. I work at Destination Home, and we're really excited about today's conversation because we started this homelessness prevention system 5 years ago. And our belief was, could we create an integrated countywide system where there was no wrong door for families and individuals to get help who are on the verge of homelessness? And would that matter? And would that keep them from becoming homeless? And so a couple exciting things today. One is we get to hear from some of our partners who do the hard work on the ground every day. And also we have our partners from the University of Notre Dame's Lab for Economic Opportunities, who's been doing who did a study for us over many years and are going to be sharing the results today. So with that, I'm going to turn it over to Chad and we'll jump right in.
Good morning, everyone. I'm Chad with Destination Home. Let me pull open our presentation. Can someone give me a audio heads up that you can see the slide okay?
It's up and it's good.
Thank you. Okay, let's dive in. So first we wanted to share with everyone about the last 5-year journey of the homelessness prevention system. It's been quite a ride, as you will see. And as Jen mentioned, way back in 2017, we started with an initial 2-year pilot. You can see the details on the left side. We started with the core of the 7 Emergency Assistance Network partners, plus Law Foundation as our legal services partner, and a relatively small 2-year budget to start off, which was heavily private funded, 2/3 private funded and 1/3 public funds, and a humble goal of serving 840 households in those 2 years. And then you can see today in the current fiscal year that just started a couple of months ago, our system is targeted to serve 1,600 households per year. We will probably go over that. We have 19 partners in the network. We have a budget of nearly $17 million. And the way that we would like to see it, and it has gone as far as the funding mix, we've now kind of reversed, and we have heavy public fund investment ongoing and private funds to round out the need and also make sure to keep our system flexible, which you'll hear a little bit more about later from Erin. So this is what the network looked like when we first started. You can see the Emergency Assistance Network partners that I mentioned and the Law Foundation. And here we are today. So we've added a ton of new partners to add expertise in geographic regions, healthcare, domestic violence and human trafficking, family shelter support, and we have a network of partners all across the county geographically. And we try to use a networked model so that the service delivery is the same across no matter which one of the 19 partners a household ends up with. So typically that results in an immediate financial assistance. Someone is coming owing next month's rent or even more, but we can also assist with other basic expenses like utilities, transportation if someone needs to get it to their job, whatever. Really, we treat each family as a unique situation and try to address the immediate need. Then we often need to connect with legal support if they're in the latter stages of eviction, case management support. So talking to the family, understanding what caused them to be in this circumstance and how we can connect quickly to services, getting benefits, making sure we're maximizing the amount of benefits and income that a household can access, and then accessing other resources like job development resources or benefit support, medical support, etc., to stabilize the household. And typically families are enrolled in the system anywhere between 3 to 6 months is the average. So across the whole system over those 5 years, you can see just kind of the breadth of the impact. Over 12,000 individuals, nearly 4,500 households in Santa Clara County, all at imminent risk of homelessness. A majority of households are families with children, and you can see a high percentage of households are both people of color and extremely low income. Those two often go hand in hand. And that's the makeup over 5 years, those trends have stayed steady. Then in parallel or in addition to, because of this awesome network of partners, during COVID, we were able to stand up a very robust and aggressive COVID-19 response that distributed over $85 million in direct rental and financial assistance. So that's not even counting the administrative funds that went to the organizations, to nearly 20,000 households, low income. You can see kind of the proportion of funds that went to each city, but even some of our smaller cities ended up having a tremendous amount of financial assistance go to them. But you can also see that where the biggest need is and the lowest income households in Santa Clara County is where the most of the dollars went. So you can see on the bottom right, the five most impacted East San Jose households, both by COVID case numbers and poverty rates, is where the majority of our funding went. Over a third of the overall funding went to those 5 zip codes. So now I'm going to pass it over to my colleague, Erin at Sacred Heart, to talk a little bit more about the performance of the system.
Thank you, Chad, and good morning, everyone. My name is Erin Stanton. I work on the network coordination team for the Homelessness Prevention System at Sacred Heart Community Service. The goal of the Homelessness Prevention System, or HPS as we call it, is to keep people housed. And you can go to the next slide, please. And you can see on the slide, we have been successful. So over the 5 years of running the program, 95.8% of families have remained stably housed while receiving prevention services. This may include maintaining the same unit that they were in, and it also can include moving to new housing, a new unit that's going to be affordable and sustainable going forward. We also measure what happens after households leave our program and are no longer receiving our services. And as you can see on the slide, after leaving the program, only about 3.5% of households that had exited the program to permanent housing became homeless within the next year. So we can see that the program does have success in helping households beyond the time that they are receiving services. Next slide. As Chad mentioned, we're very flexible in what we do. We provide an average of about a little less than $6,000 of financial assistance per household, but it varies. We don't have one set amount that's provided. We don't have a set number of months of assistance. It's customized to what the household needs based on their situation. Some households only need one-time assistance, but most households in our program receive multiple months of assistance. The amount per family has gone up over the past few years with all the challenges of the pandemic. And in particular, we have seen a higher percentage of households that need a much higher dollar amount, the over $10,000, because perhaps by the time they came to us, they had fallen pretty far behind during the pandemic. But we still see, and this has been pretty consistent over the 5 years, that the majority of households need less than $6,000 of financial assistance. And because we have so many households that actually don't need that much, we're able to be really flexible, go a lot deeper, provide a lot more for those facing really extreme situations, and still overall average out to a very cost-effective program. Next slide, please. The most common reason that people seek assistance is a loss or reduction of income. In our community, we find that incomes, whether from employment or from benefits, often aren't enough to cover rent and expenses, and any reduction in income can put a family's housing at risk. But we also see a wide variety of other reasons that people are at risk. Lots of other things happen, and sometimes it impacts income, sometimes it impacts other aspects of housing, and it can put a family at risk of falling into homelessness. And the goal of HPS is to be flexible and to be able to work with a household to provide the resources and support that they need for their situation. We have an amazing network of partners that Chad shared just a few minutes ago. that each bring their own experience, their own areas of expertise, and that helps us to meet the variety of needs. For example, over the past 5 years, we've been able to bring in partners who are experts at working with survivors of domestic violence, partners that are experts at helping families navigate the medical system. And so we can meet these different areas of need and support families with maintaining their housing. And with that, I am going to turn it over to James Sullivan from the Lab for Economic Opportunities, or LEO, at the University of Notre Dame. I'm really excited for this next portion of our presentation. We've been working with LEO from the very beginning of the Homelessness Prevention System. There was a desire to have an independent evaluation. When we started HPS, we didn't know what we would find. We didn't know how this would go, what would work, what wouldn't work. And so we wanted to bring in a partner to do that independent evaluation. It's been amazing working with LEO for the past several years. Working very closely with them as they've done tremendous work on this study. Today, you're going to get a special preview, and in the coming months, there will be a full study that will be published. So I am very excited to turn it over. Thank you.
Thanks, Erin. I'm Jim Sullivan from the University of Notre Dame and director of the Wilson Sheehan Lab for Economic Opportunities. And we're a research center here at Notre Dame that partners researchers with nonprofit service providers and service providers of state and local governments to help them identify effective anti-poverty programs. And I'm really excited to share the evidence with you today. Before I go there, let me just express my appreciation for working with Santa Clara County and Destination Home on this and all the other service providers on this project. It has been a delight to work with them, and I really appreciate their commitment to evidence. It's also maybe just at risk of getting to the key takeaway early here. It's just always exciting to share really good results. This is a very nice study that I think will have really important implications, not just in Santa Clara County and elsewhere, but elsewhere, and the results are very exciting to share. So with that, I'm going to start by showing you a little bit about how we enrolled individuals into the study, because not all of those who might be eligible or interested in emergency financial assistance were included in this study. So if you go to the next slide, if you follow the arrows, kind of helps you see how individuals seeking assistance eventually got into the study. So we start with the total population seeking housing assistance in Santa Clara County, and then restricted to those that are housed and seeking assistance. So the key restriction there is this is a homelessness prevention program. So we're not looking at those who are already homeless. The goal of this financial assistance is to prevent people from entering into homelessness. And then within that fairly large group, we were restricted to people that were in what you might call the middle range of the homelessness prevention VI SPDAT. And so those who are familiar with that scoring system, it would be maybe the middle risk group, specifically those between 8 and 13 on that risk score. And there were a number of reasons why we did that. One is because everybody at 13 and over is going to receive assistance, and so we're not able to randomize them. And then this also targets it on those who would be eligible for emergency financial assistance. We also made an additional restriction to exclude those that would be eligible for other programs from the study. In other words, we didn't want to enroll into the study individuals or families that, if they were assigned to the control group, could then also get emergency financial assistance elsewhere. So there's a narrower group because they, for example, can't document future income to be able to pay rent, that would not be eligible for other programs. So they really were only eligible for this emergency financial assistance program. And then just in terms of giving you some insights into how we enrolled them, we wanted to spread out access to the assistance over the course of the month. And at some point, we would exhaust all the resources available for the month, which meant that nobody could be assigned to the treatment group. And so at that point, we were no longer enrolling clients into the study. And then we would reactivate enrollment at the start of the next month. when we had additional resources to allocate. And so that gives us the population that's enrolled in the study. So I think it's kind of, you want to think about this as a group of individuals kind of with moderate risk within the group that is very high risk of becoming homeless. This is perhaps the exact group you want to look at, because if you think about how should we expand emergency financial assistance, who are the groups that are on the margin of receiving assistance currently? It's exactly this group. And so keep in mind that this is the group for whom we are measuring the impact of the financial assistance. So if you go to the next slide, so now we've got the group that's in that far left bubble there, the eligible families and individuals for the study. And we simply randomize those who were seeking assistance and eligible for the study to receive, to either be assigned to the treatment group, in which case they received the financial assistance, and those in the control group who did not receive the financial assistance but received all of the other services that would otherwise be available to somebody who was reaching out for assistance. And an important point here that I want to make is that we didn't, just as many people received assistance as would have without the study. We didn't restrict people from receiving assistance in order to run the study. In fact, we could not have run the study if it weren't for the case that there were far too many people that needed and sought assistance and were eligible for assistance. Then there were resources available to serve. And so that created the context in which we could run this study. In terms of thinking about what did the study do to change things, really we just changed, they're turning people away. The question is, who do we allocate the resources to versus not? And rather than say some sort of first come, first serve, we allocated based on the lottery. So before I give you the results, let me show you a little bit about who these people are that we served. On the next slide, these are just a brief set of descriptive statistics at baseline. At the time of enrollment, who were these people that were enrolled in the study? And so you can see, for example, that about 25% of those that enrolled in the study had a previous experience with homelessness over the past 3 years. The vast majority of those had some outstanding debts. And if you think about it in terms of individuals versus families, about half had children. There's two key takeaways that I want you to take from this figure. One is that the observable characteristics for the treatment group look like the observable characteristics with the control group. This is, the real benefit of running a randomized control trial. These two groups are the same in every way, except for the fact that one group gets emergency assistance and the other does not. So that allows us to fully understand the causal impact of the assistance. And the other key point to take away is this is still a very vulnerable group, right? Very high exposure to homelessness in the recent past. And there are other indicators beyond the ones I'm showing you here that suggest this is a very vulnerable population in considerable need. If you move to the next slide, I'm going to talk to you now. What you've all been waiting for is, what did we find? So you can go ahead and go to the next slide. And let me start by having you focus on the right-hand side on the figure. And what this figure does is plot separately for the treatment and control group the key outcome, primary outcome that we examined, which we're calling, whether or not they experience homelessness. But in actuality, the way we measure that is whether or not you use some homelessness services, right? So in order you show up in the HMIS system if you engage in homelessness street outreach, or if you enter a shelter, and then you are entered into the HMIS system, we observe that you have utilized services that you can only utilize if you are homeless, and that's how we identify those who experience homelessness subsequently. Now we've plotted this by month, and so just for example, to make sure you're following the figure, if you look at month 12, so this is 12 months after enrollment into the study, so after you have either been assigned to receive financial assistance or not, what you see is for the control group, those that were not assigned to receive assistance, about 7.2% showed up in HMIS as utilizing homelessness services, so those who became homeless. and just under 2% for the treatment group. This is a couple things. One is that there's a noticeable difference between treatment and control, and this difference, the 5.3 percentage points. If you put this in percent terms, this is a 74% reduction in the likelihood that you become homeless if you receive assistance. So takeaway here, this is a very large effect on use of homelessness services. Now, if you focus on the other bullet points there I have on the left, the second one says decrease in shelter entry. It's not, we looked at the separate ways you show up in the HMIS system. And when we break that down, we found declines across all of the major components. So most important was probably the decrease in shelter entry. But if we look at, say, interaction with street outreach, we also saw declines there as well. It's very important to highlight that there is this persistent effect that essentially grows over time. Because a major concern about a program like this might be, sure, if I help you pay rent today, you stay housed today, but I'm just kicking the can down the road and next month you become homeless. And what these results show is that there's a persistent effect, that this intervention is effectively addressing the emergency that is causing the immediate need, and that is allowing individuals to remain housed. So very encouraging to see this persistent effect. I should also caveat that, given that we started this in July of 2019, prior to the pandemic, we enrolled many of the study participants before the pandemic started. All of the results I'm showing you, and the ones we highlight, are those enrolled before the pandemic, because it was a very different nature of providing services during the pandemic, particularly with eviction moratoriums and the like. If we look at if we include those who were enrolled after the start of the pandemic, we see the results are much smaller, which isn't too surprising given all the other services that might be available for the control group and the restrictions on eviction. So having said all that, let me kind of summarize it again, just to make sure that the key takeaways aren't lost in all of those details. So as I mentioned before, the emergency financial assistance clearly shows that it decreases the likelihood that individuals and families enter a homeless shelter, also street outreach. They're just much less likely to become homeless. This effect is large and persists over time. The other point that I'll make is that emergency financial assistance decreases the use of services over time, and so this effect is persistent. What I didn't highlight on the previous slide is just thinking about it, the cost of this program relative to the benefits. And so what we did in the larger study is consider the cost of providing these services to individuals in need as compared to what are the potential and actual benefits that we can measure. And we compare the costs to the benefits. What we see is that for every dollar spent on the program, we get $2 to $3 in terms of benefits. And so there's a real argument on the cost benefit side for providing and scaling up this program. As with any research that we do, there's always something else that we could ask. So where are we headed next, or do we hope to go next? One is that the only outcome, homelessness is not the only outcome we're interested in or that is important when thinking about the effect of this program. Homelessness is obviously kind of the first order effect that we might consider, but in other research, we've shown that homelessness prevention is strongly associated with the likelihood that you're involved in the criminal justice system, or the likelihood that you end up checking into a hospital. So there's all these other potential benefits of this program that we're not currently measuring or capturing, and so additional analysis would allow us to do that. The other thing is that we are unfortunately still in a situation where programs like this that can move the needle are not available to everybody, and so there are a couple of ways to respond to that, but one is to kind of think about how can we prioritize who we serve in order to move the needle the most. And so more research on which groups are most likely to benefit from these kinds of interventions would be helpful for perhaps better targeting the program for those for whom the program would benefit the most. And then finally, in terms of expanding the reach, we also showed you that there's a lot of people who don't ever, so for whom this program doesn't serve at all. And so thinking about the best ways to expand the reach of the program in order to reach the others that are vulnerable but currently don't have access to the program is an important area for future research. And with that, I will close by saying thank you, and we were excited to do this project and look forward to continuing to engage in this research project with Santa Clara Destin Home and the other providers. Thanks.
Thank you so much, Jim, and all the team at Notre Dame Lab for Economic Opportunities. We've been working together so long. It's a little bittersweet that we have the results and now what, but thank you so much. Your partnership has been very, you've always been there every time that we wanted to talk through things and change and curveball through COVID and everything else. So thank you so much. And we're so excited to hear the results and share them with all of you. Again, just kind of, it's worth mentioning again that overall it works, right? The homelessness prevention system as an intervention works for preventing homelessness. But as Jim mentioned, like there are questions to be asked about how we can improve and how we can fine tune and make sure that if we have an intervention that works, that we're getting it to the right people. So we have begun kind of looking at those questions and taking the next step. We took a look at the data that is in the LEO study. We also looked at some other studies that are coming out across the country. And then finally, and perhaps like most relevant, we started taking a deep dive into our own treasure trove of data. We have the Homeless Management Information System data that all of the partners in the homelessness prevention system, as well as another 30, 40 other nonprofits across Santa Clara County use as a shared collective database system, which is extremely powerful, and started taking a look at the data that we have in our homelessness prevention system, kind of enrollments, the initial assessment, and comparing those to the folks that are coming in and saying that they're homeless for the first time. We call that inflow. Kind of technical inflow outflow term, but to really understand, what can we learn and how can we fine tune? And here are some kind of preliminary findings from looking at the data that you can see, and I'll talk through briefly about how we're thinking about next steps. So we're looking at disabling conditions and seeing that a majority of people who are becoming homeless are reporting a disabling condition of some kind. And so that's something we want to look into a little bit more. Disabling conditions can be very broad, but we have more specific data that we might be able to get hold of if we can partner with the healthcare system, for example, and see hospital level data and healthcare provider data. So that's an area that we can kind of expand into other systems where we know people are falling into homelessness. Similarly, and just as important is the justice system involvement. We're seeing that 61% of people becoming homeless are reporting having spent time in jail, and so that's another parallel system, highly interrelated with the homeless system of care, but a separate system that we want to use this data and forge new partnerships and new ways of working and connecting the systems to make sure that we can catch people that we know are justice system involved and are going to become homeless at a higher rate. And then finally, and Jim mentioned it too, but we're seeing this validated across the board. People who have past experience with homelessness. And this one, you can see almost 80% of people who become homeless have had prior instances of homelessness. I look at that and I'm like, ding, 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 this is telling us something. We need to take a finer look, a closer look, and really kind of maneuver our systems to make sure that if we know someone's been homeless before, that we're making sure that we're really paying attention and providing prevention services, because we know that compared to the general population, much higher chance that people are going to become homeless. So I'm going to pass it over to Jen to finish us out.
Thanks, Chad, Erin, Jim. it's great to see that the last many years of our work together has been impactful and fruitful, especially what everyone did together through COVID. But if you know me, we're only as good as what we do next. So we need to have a real frank conversation about what we're starting to see, which I think will not be a surprise to anyone who's doing this work here right now. But this slide is really giving us pause. So our local program, you see where that stopped, the $85 million that we spoke about. Cases are starting to rise. When the state closed its program in March, it's starting to become catastrophic. So we are deeply concerned about the amount of people that are coming to us post expiration of protections, of financial resources, of the additional tools that were thankfully made possible by our state and federal governments, that we need to have a serious talk about what we're going to do now. And not only are we seeing cases starting to spike, but the amounts that people owe are dramatically different. People are owing $15,000, $20,000, $30,000. To be clear, we don't have enough money to meet this need and this demand. And so we are deeply concerned about the trajectory and what we're going to do next. So the next slide is why Destination Home and our partners at the county and the city of San Jose has been so committed over the last 5 or 6 years to Measure A and building extremely low income housing. But you see this rental burden is a crusher. Over half of everybody who's coming to us is coming in 100% rent burdened. This is an unsustainable crisis that one-time assistance, repeated assistance, it's not going to solve it. We need rents to be lower, or people's income, or through the use of things like guaranteed income or universal basic income to be higher. And so this slide in particular, shows really the rot at the root of our housing system that doesn't build the type of deeply affordable housing that people need to be able to live in this region, but in regions all throughout the country. And so this is extremely sobering as well. So where do we go from here? Next slide. In addition to the things that Chad has spoken about, you can see what we've been planning to do when we started this calendar year. Grow next year to 2,000 households, grow the year after that to 2,500 households. We need to be able to accelerate these plans. We need to be able to have enough money to serve the folks that we're seeing. And being able to do this together is really important. Jim mentioned the cost benefit to preventing people from losing their homes versus the costs of what it takes if people are homeless. Our system does not have enough emergency options for people, right? If we are going to be pushing people to homelessness at the rate that we're seeing. And so this is really serious for us. We're in conversations with our colleagues about what we can do, but we need to be thinking about this from a funding perspective, from a policy perspective. Now is the time to do everything we can to keep more families from losing their homes. It's going to cost some money, but it's an investment not only in the families, but in our community as a whole. So to talk a little bit more about what people are seeing on the ground, it's really my pleasure and excitement to have 3 of our partners with us today. We have Aida here from Community Solutions, Sujatha from West Valley Community Services, and Ming Lin from ICANN. And these powerhouse women are with us to talk about what they are seeing on the ground in our homelessness prevention system, what they're worried about, and what we all can learn. And so we're going to ask some questions for them, and then please put questions if you have them for Jim, for Chad, for Erin, for the panel. Put them in the chat, and we will get to them. So why don't we go ahead and get started? And why don't we start, Sujatha, is it okay if we start with you? You heard me talk about families being severely rent burdened when they show up for help from the homelessness prevention system. Does that ring true to what you're seeing when families are walking through your door?
Yes. Can you hear me, Jen?
Yes, I can. Hi.
Yes. So We are seeing that. We, as you know, as part of the Emergency Network Agency, West Valley has been part of the homelessness prevention from the beginning. And what is new that we are seeing is even after the slowdown with the state assistance and the moratorium being lifted, families owe back rent. Because of the cost of living, and there has not been much increase in their income. They're still struggling to find a job that's stable, meets their family's need, their own personal needs. They are rent burden. We are seeing families now who are coming with $30,000 back rent. They are at risk of eviction. That's one, rent burden. We are also seeing this rent burden because cost of living is going up. Cost for food, for transportation, everything has gone up for these families. So wraparound services is becoming very critical, and we're trying our best with weekly grocery and other things, but that's not helping. They're all working families. I want to plug in that a majority of the families who were seeking this had loss of income, but they have employment history, they have job history, they've worked in the past. They're doing minimum wage job, which is not going to keep them up with the rents we have. Now, also, affordable housing wait lists are so huge that today, if a family who's coming to me, and I'll give you an example of Rita, I'm working with her. She is a home daycare provider. She used HPS system. She was stable. If she loses her housing, she'll be at the bottom of 300, 400 more folks who are on the list. She does not have a chance. She has a chance if we can provide her the rent assistance now to prevent eviction. But if she gets out of that system and becomes homeless, she's going to already burden the shelters. She's already going to burden and putting herself on the wait list. She doesn't have a chance. So we are seeing that. The other thing we're seeing is a lot of evictions. Once the eviction moratorium got lifted, we also saw many, many landlords and property managers are seeing our clients as high risk, and that is causing a lot of issue. And for some of and I will support it from the renter perspective, they were also burdened because they hadn't received the assistance, and they are small business owners too. So I want to bring both aspects of it. But evictions are coming in. We are coming with a lot of 3-day notices. In my 14 years, this is the first time I am worried that by December, we will run out of our emergency assistance funds. And as an EAN agency, I'm scared, like January, if someone from Cupertino comes in with a 3-day notice, if they qualify under the HPS system, yes, we will have, but if not, and they need a short-term assistance, West Valley will not have the money.
Thanks, Sujatha. Aida, I want to ask you a question. We all know the pandemic exacerbated the challenges that many of our lowest income and vulnerable families face. Now that society is emerging from the pandemic, what are some of the new challenges that families are facing?
Well, yes. So COVID had a great impact on all of our families. And so as we're coming out of it, we're seeing, as already mentioned, the evictions are coming in rapidly and with a much higher amount of money that is due and owed. And so when we're working with marginalized families, they have low paying jobs. They have little or no skill set to secure the jobs needed right now to be able to afford the rent in our valley. And for community solutions, when we're working with marginalized families, we're also working with those who are survivors of domestic violence. And so that is, if you so, it's horrible to say, but it's a double whammy. So you're faced with becoming homeless, but you're also faced with navigating a system to be able to secure a safe home for your family. And so those are the challenges that we're seeing with our families. And for some of our folks who are working, the affordable childcare, there is no affordable childcare in our valley. So you have to make a decision, do I go to work or what do I do with my children? They have to also be safe. And so, so those are some of the issues that we're seeing that is absolutely compounding the fear of instability around housing, the fear of evictions. And one thing that we're seeing my case managers really work really hard is contacting landlords to say, how can we work through this together? Because we cannot afford another family on the street. And just statistically, we know that 50% of the women who are homeless right now have had some kind of form of gender-based violence. And so those are some of the challenges being faced by our families. Where Community Solutions is down in South County. And again, we work with a high marginalized family population, a lot of immigrants, a lot of undocumented folks who do not have access to benefits. It's another challenge that our families are facing.
Thank you, Aida. Lynn, how are you? Over the last 5 years, we have worked to add more community-based partners to the homelessness prevention system, in part to make sure that we have cultural competency in working with all different components of our community. So we've been in partnership for a few years now. And do you think that this work together has helped provide more resources to the communities that you serve?
Yes, definitely. Good morning, Jennifer. Good morning, everyone. Thank you. Compared to West Valley and Community Services, ICANN is a new member. We just recently joined. This is our first year, and we were brought in because of our outreach to the community, in the Vietnamese community specifically. And since we've been here, we found out that the Vietnamese community has always been have not been using the programs. From our interaction with them, we find out that this is greatly needed. And from our database, we found out that right now we've seen an increase in clients from the elderly population. 35% of our clients are elderly who are on fixed income. They are starting to have a lot of rent anxiety because their disposable income has been decreased. When we offer them our services, and in some cases where we have community free lunch programs, they will not miss a day because they're afraid that if they don't come and get the free lunch, they're not going to have the money to pay their rent. So they're saying at some point, if rent keep on increasing and food prices keep on increasing, they're going to have to ask themselves, do they want to be fed or do they want to be housed? The other large part of our population we're seeing are single moms with young children. And these are newly single moms because of COVID. Their partner, their income earner, died because of COVID. And so their loss of a income earner, of the primary income earner, and they've just been here to America from Vietnam. They don't know the language, they don't know the system, they don't know the law. All they know from their own country is that, you know, if you don't pay rent, you're out. They're not aware of the law protecting renters. They're not aware of the different resources that's available for them here in the States. So with the HPS program, we offer case management. We're also able to connect them to other services like West Valley and other areas that will have other CBO that will give them resources for job training, lawyer services. When we told them that, they were like, oh my God, I didn't know such services exist. And I was not able to really know what's going on until you were able to tell to me in Vietnamese. And they were afraid to talk to anybody about it because they're afraid, you know, if they get homelessness, their children are going to be taken away from them, right? And the other ones that we see in our demographic is people who already established high income, used to have high income. They used to have businesses, but after COVID, their businesses were decimated. They lost their job. And afterwards, it was hard for them to regain the job. And now they're facing situations where they have to find new place to live. But they're telling me, well, the application requires that you have an income 2 to 3 times your rent, but rent is increasing. Their income is decreasing. They have additional burden of child caring for young children. They're not able to meet these criteria. And so HPS is really helping them to make that transition, to get them housed so that when they go to our other CBO partners or when they go to the county to apply, they still have an address to put on their application. Because once they have no address, it's hard for them to access all these resources available to them. So this is where I see how HBS is really, really crucial. And this is just my first year, my 1 year. And I've seen so much that just boggles my mind. So I'm very thankful to be part of this program. And I'm really, really nervous about the future because as you can see, inflation is rising. We see fuel prices going up around the world. We see food prices, food shortages going. So their disposable income is decreasing and rent is increasing. So like everybody else, I share the same concern because we're the last line resort. We're help bridging them. But as more people get on the bridge, it gets strained, right? So we're going to need more bridges and making the bridge longer because as Sujata mentioned earlier, the wait list for housing is really, really long. And since we only have enough enough resources to bridge them for 6 months, while the wait list is 2 to 3 years, what are we going to do? So thank you for your time.
Thank you, Milan. I'm going to ask the same question of all three of you, but Milan, why don't we start with you? We know we have a lot more to do in our fight to end homelessness in Santa Clara County. What's one thing that you think, especially with your newcomer perspective, that either the homelessness prevention system or the supportive housing system could do to improve the work that's underway?
Thank you very much. What I'm seeing is I'm labeling certain cases where they are temporary, that we just help them and they're back on their feet. But I'm starting to see a lot of cases, like for instance, the elderly and the single mothers, where they're not able, it's like they need long-term solutions, right? So, and I understand, like for example, Section 8, we're trying to get them in the waitlist program, but you know, they can't wait for a year. So I'm hoping that maybe we can have like a pipeline where the government or the county can work with us to help like do a fast track lane, because we already have other documents. We provide the translation services for them. So, you know, that won't be an added burden to the community, to the county or to the government. And we can facilitate the application process for somebody that has been identified as high risk, that somebody already has an assigned case manager to them. So we can work with you so that you don't have to double down asking for documents because we have all those already in place. So that way we can reduce some of the maybe duplicated resources.
Thank you very much. Aida, how would you answer that? What's one thing that you see that we can improve upon?
You know, I agree that fast tracking is extremely important, but also I think it's working, for example, with the property management companies. It's loosened up so that criteria to get into an affordable housing place, our families do not make 3 times the rent so they can qualify for an apartment. So that's one way that I see bringing our real estate community around the table. What can we do together to solve the situation that's at hand? Because we're not going to be able to do it by ourselves. We need all the brains that we can around the table. Another thing too is, you know, how do we get our families to become self-sufficient? I know our families don't want to depend on help forever. So bringing in some kind of workforce development to be our partner, to be able to bring people and build their job skills so they can afford to secure jobs in our county that develop a different job skill because they need higher income to afford the higher rents. And so I think maybe a path to, yes, affordable housing immediately, working with our real estate development partners, and also working with developing a very successful self-sufficiency program where they get the skill set that they need to become self-sufficient and be really proud, because all of our folks want that. They all want to be self-sufficient, be able to pay their own bills. For example, some of the families that come to us, by the time they come to us, their rent is so far in arrears, and it's because they were embarrassed to ask for help. really embarrassed to seek out the help that's there for them. So I think if I had a wish, I would do those three things. Fast track, as my didn't mention, bring our real estate partners. They're awesome folks. Bring them around the table. And lastly, let's develop together something that's going to work for our families so they do become self-sufficient.
Thank you, Aida. Sujatha?
Jen, I wanted to just bring up some historical perspective, if that's okay. So, I mean, we have done such an awesome job. We started with EAN, then recognized that there are other organizations who are not at the table where the clients are going. One thing I loved is how we made the shelter hotline get connected, because most of the time, client who are getting, when someone is going to get evicted, the first thing they think about is, I'm going to become homeless. What's my next step? And having these grassroots partners has been awesome. So I want to pause and celebrate and recognize that expanding to more partners and asking these questions constantly: who's not at the table, where do our clients go, and trying to map out the community is excellent. The other slide that you all mentioned is, again, looking at those percentage of, the disabling conditions, people who are, the families who are already in the justice system, what we can do. But my big ask is, homelessness prevention system is not a one-time pilot program. It has to stay. This is the only way we can reduce and the cost, which will increase if these families go into into shelter. So Leo's study shows is $1 to $3. So there is a huge return on investment. We cannot think about doing any work in homelessness without investing money in homelessness prevention. So I really believe that there will be a commitment. There will be this commitment long term, that as we think about other things that's happening in the homelessness agenda, where we have to look at housing, affordable, prevention is as much critical, and we need the support, financial support, and the political backing to continue this work that Destination Home and all of us are doing. So I'll pause there.
Thank you, all of you, ladies, for taking the time to join us today, but also really, truly for the work that you do every single day. It's been an honor for us to be a part of this system, but we know who does the hard work, which is the network partners and under Sacred Heart's leadership. So thank you all. We have 6 minutes left, and I know we have a few questions. So Kathy, why don't you, if there are questions in the chat, can you read them to us, and then we'll see who's the right person to answer.
Yeah, of course. So we have one question from Sakura. Hopefully I'm saying your name right. Why did the funding source shift so much from the beginning, primarily private, to today, which is primarily public?
That's a great question. First of all, it was a lot smaller at the beginning. The homelessness prevention system is part of the Santa Clara County supportive housing system, which has really something that has been co-created over the last 7 or 8 years. It's basically one effort for permanent supportive housing, rapid rehousing, emergency housing and shelter, and homelessness prevention. Destination Home was the originator of beginning the homelessness prevention system at the same time that the County of Santa Clara and the City of San Jose and others were working on the supportive housing side of the equation. And so we started by going to our private funders and raising private money to do a pilot, because to Jim's comments about what we found during the study and Erin's at the beginning of when we started, we didn't want to do something and have it not work or have it not be successful and use taxpayer money, right? And so we started the system, but we had our public partners with us together. And the assumption was, if this works, we're going to want to grow it and help more people. And so as we were able to show that it was working, we were able then to have government allocations join into the homelessness prevention system and helped us to be able to grow it. One significant contribution was the passage of Measure E at the City of San Jose. That was a ballot measure that, if you can remember, we voted on in February 2020, and luckily right before the pandemic. And it has money that's freed the City of San Jose to invest. And the County of Santa Clara has used their sources of funding, and we have leveraged state money into this as well. So the truth of the matter is you can't sustain something in perpetuity on private dollars. It needs to be institutionalized into a system of care if indeed it's demonstrating impact and results.
Great answer. So the next question we have, we talked about this before, but it's definitely worth revisiting. Rob asked, what is the unmet need in Santa Clara County?
Who would like to take that?
Erin, do you want to talk about the percentage of people that we're able to help compared to how many people are seeking assistance?
Sure. I think it's hard to directly answer that question because we are seeing such high need right now that we can't even really answer every phone call. So we don't have data on every person out there that needs this assistance. And as Jim alluded to as well, there are people that we're not even reaching yet. But what we do know is that the people who do know about us and are reaching out to us, we are only able to assist no more than 25% of those that are seeking assistance. And that's because the volume of the need is so much higher than what we have capacity to assist. And as you saw in Chad's slides, our capacity this year is to enroll 1,600 households. So that means even among those who are getting connected to us and that we have the capacity to talk with them and do an assessment, we are turning away 3 times that many.
I definitely echo what Erin just said. We are turning more than we can help, and it is heartbreaking. So the numbers that we are saying that we're helping, please multiply it by 3 for the numbers that we are not able to help.
And here's the thing about that. It's within our control. We have a model that's working. We could grow it. We can't grow it alone. Sometimes we make suffering, it's like stupid suffering. It doesn't have to be this way, but for some reason it perpetuates here and in every community across the country. It doesn't have to be this way. Kathy, are there more?
We have a few questions left, but since we're running out of time, the last one that we have for today will be, what is the process for referring clients to the homelessness prevention system?
Erin?
Yeah, I can take that one. So the easiest way probably for all of you that are on a webinar to learn more about how to connect folks is to go to our website. We have a website for the Homelessness Prevention System, which is preventhomelessness.org. If you go to that website, we have it in multiple languages, and you will see information about HPS as well as our phone number. We have a central phone number that folks can call to get connected to the system. We also have an email address that folks can use to get connected to the system. And also available through that site are our flyers in multiple languages. The flyers also include the information for connecting directly with all of our partner organizations. So for example, if someone lives in the west side of the valley and maybe already goes to West Valley Community Services for other services, they may see West Valley on there and want to go directly there. If someone is part of the Vietnamese community, they may feel most comfortable reaching out directly to ICANN. Survivors of domestic violence or human trafficking or sexual assault may feel most comfortable reaching out directly to our partners who provide confidential services for those populations. So folks can get connected to us either through the central phone number and email or by going directly to any of our partners.
Thanks, Erin. We like to start and end on time. It's exactly time. So thank you for everyone joining us today. I see the chat activity. If you have more questions or you want to get involved or you have someone who needs help, please, this is just not just a one-time thing that we're doing today. So thanks everybody for your time and have a good rest of your day.